my honourable friend give way?
Yes.
I thank my honourable friend for giving way. On the point of life expectancy, as we know, public health interventions cost only a quarter of clinical interventions to add an extra year to life expectancy. So would my honourable friend agree with me that the reduction of the public health grants was appalling false economy and should be restored as soon as finances allow to at least 2015-2016 levels of funding? Thank you.
Dr. Becky Cooper.
Thank you, Madam Deputy Speaker. The Darzi Review has effectively shone a spotlight on the key issues that GPs and all in the healthcare profession have experienced over the past 14 years. It rightly highlights the detrimental impact of austerity and the increased pressure that the pandemic put on an already stressed service. It also draws attention to the ongoing excellent work that is being done by NHS staff across the country in spite of, rather than because of, the facilities, systems and processes that are not fit for purpose and must now undergo intelligent reform. Primary care is an essential part of our health system. It is where prevention meets treatment, and GPs can effectively undertake secondary prevention to keep people well for longer. For example, people with chronic conditions such as diabetes and hypertension. So as a public health consultant, I want to fight for our GPs and make sure that they have the resources that they need. So I want to highlight three things today. I often speak to the Royal College of GPs, and we are in sync with these three things that I would like to raise. Firstly, the long-term workforce plan. It is due for review next year. It has been underfunded in previous times. And we have to look at the modelling that is in the workforce plan now. If we are moving from a hospital to a community model, we have to look at the rate of increase that we expect in our GP service. It currently stands at 4% for GPs and 49% for hospital consultants. That is in no way detrimental to my colleagues who are hospital consultants. They are incredibly important, but we need to review this workforce plan. And I know that the Public Accounts Committee were looking at this prior to the election, and as a new member of the Health Select Committee, I will encourage that work to continue. Secondly, we were talking earlier, Madam Deputy Speaker, about a mixed model of GP provision and how that will work. In my own constituency of Worthing West, the Worthing Integrated Care Centre is due to open very soon. It is a neighbourhood model where GPs will work with other healthcare professionals to provide a holistic wraparound service. But as has already been demonstrated in this chamber today, there are already partner practices that are working effectively. So it's the interaction between neighbourhood hubs and those partner practices. In the terms of pragmatic politics, we need to get those to work and work well for our GP colleagues. And finally, we have talked, Madam Deputy Speaker, about the National Retention Strategy. GPs are leaving currently in their droves, and even though we have many people coming forward for GP trainees, it has been said in this chamber that we must make sure that we retain our GP colleagues. This is particularly acute in deprived areas. As a public health consultant, health inequalities are one of the major issues in this country. And in order to address that, in order to make sure that prevention is writ large for those areas of health inequality, we must make sure that we are retaining our GP colleagues in these areas. Many thanks.